So, Tony, it's amazing. It's wonderful to have you here today and that you can share some of your time so that we can ask you a few questions.
Thank you, Johnny. It's really great to be with you.
So, the first thing I think of concern is the fact that it's just recently that the vaccine for kids, Pfizer vaccine from 5 to 11, has been authorized for emergency use. But, there's a lot of concern about that. Why is this vaccine raising so much opposition, so much suspicion? Is it basically any different than all the other vaccines we give our kids?
No, not really at all. As a matter of fact, we give children a lot of vaccines, even for diseases that have less of an impact on children than COVID-19 does. There is a considerable amount of anti-vax approach, and with people who might just be fundamentally against vaccines for a variety of reasons. But there are also legitimate questions that parents have about the safety and the advisability of getting their children vaccinated. And often, if you extend yourself out, usually by trusted messengers, such as a family pediatrician, and answer the appropriate and relevant questions that parents have, you can convince a substantial proportion of the parents about why it's important to get the children vaccinated. But we must be realistic, in an era of pushback for anything that comes from authority, like scientists or physicians or government. People are very suspicious of that. We certainly have a considerable amount of that here in the United States.
I see. So the question is, are there any cases in which there are indeed long-term effects? Are there any vaccines? Obviously, with COVID-19, there hasn't been enough time. But can you think of any examples of vaccines, any vaccine, that has long-term effects months and possibly years later?
To my knowledge, Johnny, there have not been. In fact, that's the reason why when the FDA makes an approval, for example, with an emergency use authorization, they usually wait about 60 days from the time that half the people have received their last dose. And the reason they do that is that if you look statistically at what are called long-term effects, not the reactogenicity that you get a day or two later with a sore arm or muscle aches or maybe a little fever, but things that are more late. Almost all of them, in fact, virtually all of them, occur within 45 days.
I see.
And we've had plenty of time to observe that. So the idea that all of a sudden 5, 6, 10, 15 years later, you're going to see an adverse event, we've just not seen that with vaccines.
Now, another issue which is specifically relevant to this now vaccination of young kids and especially girls, there has been evidence that the vaccination, I don't know if it's coincidental or if it's causation, but there have been reports on effects on the monthly period, sometimes spotting and bleeding. And so young kids being vaccinated, there's concern, does it have any effect? Is there any evidence of vaccination, how it could impact and cause any deleterious effects to fertility, especially in kids and girls, that is to say?
No, actually, obviously you have to look at what we've seen with adults, for example, even young adults who've been vaccinated. There is no indication whatsoever that it has anything to do with fertility of women or the ability of men to procreate children with their sexual partner. So there's no evidence of that. I mean, obviously, when you're dealing with kids, we haven't seen any effects because we have not had the opportunity when you're dealing with young children by the time they get to the age when they can procreate. But what you've got to look at, Johnny, there's no mechanistic, plausible reason why that should be the case. I mean, if you could think of some possible mechanism, but when you look at the vaccines we're dealing with, not only has there been no experience that this has happened, but you can't even conjure up a mechanism of why it would happen.
I see. So let's go to the flip side, the more positive aspects. clearly the introduction of the new vaccines within a year's time is remarkable, and it's definitely precedent in the sense that there have been no vaccines that have been designed, produced, and rolled out within a year. What can you say were the major reasons and underlying activities that allowed such a remarkable achievement?
Well, there are a couple that stand out, Johnny, that are very important. First of all, people understandably don't fully appreciate that the science, the fundamental basic and clinical science that went into the development of vaccine platforms like the mRNA and or importantly, the development of the optimal immunogen, such as that stabilized prefusion spike protein, which has played such an important role in the very important immunogenicity of the vaccines. That work antedated COVID-19 by decades, literally decades. So we didn't start in January of 2020 when the sequence of the virus was put on a public database. It began 10, 15, 20 years before. The other thing that was very important was the enormous investment that was made predominantly by the United States government in pre-purchasing and paying for the doses of vaccine before they even were shown to be effective. So it was a phenomenal billions and billions of dollars of financial risk, because when you do a vaccine that isn't a public health emergency, you do it in a sequential fashion. You see if the vaccines work in a phase 1, phase 2, phase 3 trial. And if it does work, then you begin manufacturing it, getting it ready to distribute. That was not done. Billions were put into it in order to get a jump start. So it's a combination of a large financial risk, which actually paid off, and decades of good science, eloquent science, that antedated it.
I see. Now, we're in Israel now, and some of the Israeli public have made the comment that Pfizer BioNTech has used the Israeli population to some degree as a guinea pig, because we started our vaccination with Pfizer very early on and have been extremely effective, at least in covering the population above 60 and 50. Can you make any comments on that? Has the rollout in Israel actually assisted, contributed to the world pandemic in providing evidence and data?
I look at it exactly the opposite, Johnny. I think Israel was really lucky that they got their implementation done so quickly and so effectively, not only with the initial vaccine, but with the booster program. I often, when I push to get our booster program going, I refer back to how successful the Israelis have been in getting virtually every age group now boosted. And it's very clear that the third shot of the two-shot mRNA vaccine is really important in enhancing not only the immunological response, but also the clinical benefit that one gets at all age groups from the booster. So I look at it is that Israel is where you wanted it to be, not being the guinea pig, but being right up there, getting this benefit more quickly than most any other country.
So generally, I don't want to ask you to score us, but can you say overall, how have we coped with the pandemic in the meantime? And are there any strong points, weak points that you would point out? Where have we gone wrong?
Well, I'm not so sure you've really gone significantly wrong. I mean, this is a moving target. You know, we all were hit with the initial wave and then the big surprise with Delta. which is a variant that has much greater capability of spreading from person to person. We were all, I believe, surprised by how very efficiently Delta spread. Now that we know that, that's an extra added incentive to get people vaccinated.
So, if we look at the global effect, obviously the pandemic has been more than just a health crisis. The whole pandemic has had enormous, enormous impact commercially, internationally, politically. Could we have handled the pandemic more efficiently? Could there have been things early on that we had done which would have been more effective and possibly made it easier and restricted the spread of the pandemic?
The answer is obviously yes. When you're dealing with such a difficult situation as we are now, I think it would be foolish to think we could not possibly have done things better than we did. But very often that relates to, if we knew then what we know now, would we have done things differently? Obviously, because the outbreak has been a moving target. When we were dealing with this in the very, very early stage, I think the whole world, if we had quickly done very dramatic mitigation methods, like shutting down more quickly, making sure people were wearing masks and not doing indoor things. But people, in many respects, understandably felt, well, maybe it's not going to be as bad as we think. You know, we had SARS-CoV-1 in 2002, and that was very well controlled by just common public health measures of identification, isolation, contact tracing. But what we didn't know was the major difference, and that is the incredible capability of transmitting from person to person, but particularly the fact that 50 to 60% of the transmissions occur from someone who has no symptoms. That was very, very different from the original SARS-CoV-1. And that's the thing that fooled many of us in the beginning. We didn't realize how insidiously this could spread. Excuse me.
So let me then ask, as far as the early stages in trying to deal with the pandemic, there have been accusations, comments that the Chinese could have been more effective. Personally, if the initial observations, the first cases were somewhere in the middle of December 2019, and the Chinese already published the complete genome of the virus in the middle of January, I think, if I'm not mistaken, January 10. How could have they been more efficient, more open, quicker? How responsible or not should we point fingers or not to the Chinese? What is the origin of the virus?
Well, I mean, we don't know precisely the origin, but it almost very, very likely was a natural occurrence similar to SARS-CoV-1, similar to Ebola, similar to MERS, where you have a reservoir in an animal species that jumps species and goes to human and then takes off in an outbreak. Again, you don't know definitively, but most of the people who understand viral phylogeny and molecular virology feel that it is very likely have been a natural outcome. But again, you need to leave an open mind. Could it have been something that they were working on in the lab that escaped from the lab? That's something that is, hopefully we'll get to the bottom of that so that people will know how to best avoid things in the future. But I really don't think that is productive to point fingers at any country. Outbreaks arise in different countries. They arise almost always naturally. And I don't think that one can say it's someone's fault. Perhaps they could have been more transparent in the beginning. I believe they could have been a bit more transparent as to what was going on there. But the Chinese often that's their pattern. They tend to hold back because they don't want any negative consequences on them. But again, getting back to what I said, it's not productive to point fingers at anyone.
I fully agree. Now, one thing that I've observed, I mean, we go back a long ways. You, Debbie Burks, of course, Bob Redfield, and others, a huge number of the people who are contributing in the fight against COVID-19 are all the pioneers in studying of HIV. So tell me, how has years of research on HIV/AIDS prepared us to better cope with the emergence of corona?
Well, in some respects, it has prepared us because you realize that outbreaks occur. We've been saying this now. I've been saying that since the beginning of my career 50 years ago, but particularly since I became director of the Institute almost 40 years ago, 37 years ago, actually, this month.
Congratulations.
It's a long time.
It
and
sure
we've been
is.
through a lot of different outbreaks. So you're right. One of the things that we've learned, don't ever underestimate the capability of an emerging infection, because you remember I was involved right from the very first days of the recognition that we were dealing with a new disease with AIDS in the summer of 1981. And I have been studying HIV/AIDS ever since then. That is a little bit more than 40 years and a few months. But the thing that you learn, the lesson you learn, is that outbreaks take different forms. The HIV was very insidious, under the radar screen. A few people infected in Los Angeles, New York, San Francisco. We didn't fully realize that under the radar screen, it was spreading throughout the world, particularly in sub-Saharan Africa. Here, with COVID-19, it came on like an explosion. I mean, you had a situation of a few cases in the Wuhan district of central China, and then all of a sudden you have major outbreaks in Europe and in Italy and in northern Italy, and then the rest of Europe, and then the big explosion in the United States. And it's all taken place within a relatively short period. With HIV, it was chronically over 40 years. And the numbers still are terrible. We have about 78 million people have been infected with HIV. About 36 million have died. There are over 36 million people living with HIV, but that was over a 40-year period. What we have with COVID-19 is a different kind of an outbreak. We have now, over the 19, 20 months that we've been dealing with it, 750,000 people in the United States have died. So that's about the same number who've died from HIV/AIDS, somewhere over 700,000. That took place over 40 years. This took place over 20 months. That's the difference.
So have we learned anything from dealing with corona, with COVID-19, to help us prepare for, God forbid, the next emerging pandemic?
Yeah, there's a lot of lessons learned. One of the things that was the success story of this outbreak was something you mentioned in the beginning of the interview, was the extraordinary speed and success that we were able to implement with the development of highly effective and safe vaccines. So we've got to continue to prepare from a scientific standpoint, but also simultaneously, we absolutely need to enhance our public health infrastructure, both domestically and globally. We've got to be able to respond much more efficiently, from surveillance to communication to responsiveness. And even as we are struggling through the current outbreak, we are planning a major pandemic preparedness approach for just what you are referring to, Johnny. the fact that we will inevitably have another pandemic. It may not be as severe as what we're going through at now, but sooner or later, we're going to get another pandemic. And it really behooves us to be much better prepared, even though, by all accounts, we were supposed to have been very well prepared for this. Obviously, when you have 750,000 deaths in your country, that doesn't really reflect a great deal of effective preparedness.
Sure. So you're saying with regard to the vaccine, is this the new paradigm? Are we going to see the U.S. government or other governments pitching in, assuming the financial risk and dangers, speeding things up, running things in parallel with the new vaccines to come?
I think when you're talking about vaccines for pandemic diseases, Johnny, I think this is the paradigm that is going to be repeated because of the extraordinary success. We took a big chance financially with Operation Warp Speed, and it proved to be highly successful. So I believe that at the next time we get a pandemic, not only will we be better prepared with the prototype pathogen approach, but I believe you're going to see the same sort of upfront investment in order to get things moving quickly.
Now, what about medications and therapeutics? Obviously, with HIV/AIDS, the whole world of antivirals emerged and has proven to be extremely successful, also with hepatitis C. Do you see any new generation targeted medications for corona?
Absolutely. In fact, that's exactly the model we're following, the same model that led to such a transformingly successful therapeutic approach to HIV, where, as you well know, in the beginning we had nothing and it was almost an inevitable death sentence for people. And then as we developed targeted antiviral therapy, which led to the successful combination of drugs, we've now transformed the lives of persons living with HIV. The same approach is being implemented now with our antiviral program for pandemics. We refer to it as APP, Antiviral Program for Pandemics, where we're doing the same sort of targeted antiviral therapy, looking at vulnerable parts of the replication cycle of the virus, be it protease, polymerase, binding to the membrane, the same approach that was so successful with HIV.
I see. Well, obviously that's encouraging, and we do have to be optimistic. So if we are optimistic, are we just about out of the woods? Do we see an end to the current corona pandemic?
Well, no doubt it's going to end, and I believe how soon it ends is really going to depend on how successful we are in getting the world vaccinated. And that's the reason why, even though we're doing very well, Israel is doing extremely well in getting an overwhelming proportion of their population vaccinated. I very, very much am in favor of the booster program that Israeli is doing. And I would hope that we would be doing that soon in the United States to the level that the Israelis are doing that. But we must not forget that we have a responsibility to get doses of vaccine to the developing world, the low and middle income countries that have far less of an ability to be able to get their population vaccinated. We've got to supply them with doses, because the only way you end a global pandemic is to have a global response. And we've got to make sure we have much more equity in getting doses to people, no matter what their economic status is throughout the globe.
I think that one of the hurdles that we are facing now in Israel, and I know in the United States as well, is how to overcome the anti-vax, the fake news, the reluctance, the hesitance of people to get out there and vaccinate. Especially in a small country, we have a couple of 100,000 that just do not get vaccinated, and that obviously is severe with respect to herd immunity.
You're absolutely right. I think that's one of the biggest challenges that we face is the fact that, and it's very frustrating, Johnny, because sometimes we're faced with diseases that are potentially or in reality devastating, but we don't have interventions. It is so frustrating when you do have not only an intervention, but a highly, highly effective intervention, and we don't maximally utilize it. It just is really unfortunate because if we could get all, I mean, in the United States, for example, there are 64 million people who are eligible to be vaccinated who have not yet gotten vaccinated. That is just should not happen when you have such a highly effective vaccine. And the reasons vary. Some of them are ideologic. Some of them are politically motivated. Because if you look across the United States at the under-vaccinated states and the states that are very well vaccinated, it goes along party lines. I mean, the red states, the Republican, are much less vaccinated than the blue states, which are Democratic, which doesn't make any sense. There's no room for letting ideological differences impact the public health response.
Obviously, we don't know if the virus is a Democrat or a Republican, and so you're absolutely right there.
Exactly, and the virus doesn't care who you are.
That's right. Well, Tony, I see we're running out of time, so I really, really want to thank you so very much for taking time to speak with us. Here, we certainly appreciate the knowledge, the answers, the questions. They help us better understand our past and when we're going in the future. So thanks again very, very much.
Thank you very much, Johnny. It's a pleasure to be with you. Thank you for having me.
It's always a pleasure.
Thank you, Johnny. Good
Cheers.
to be with you.
Yep. Okay. Hopefully we'll see you. Bye-bye.